We have all had headaches, but when do headaches indicate something more serious than just a tension headache? Here are the red flag signs and symptoms of headaches. They are abbreviated by the mnemonic SNOOP. S indicates systemic signs and symptoms like fever, weight loss, night sweats, anorexia, neck stiffness, photophobia. If you have these symptoms, you could be having a brain infection like encephalitis or infection of the meninges, such as meningitis, or even a brain metastasis from a cancer or HIV, and so on and so forth. N stands for neurological symptoms like altered consciousness, confusion, focal neurological deficits, whether motor or sensory, and so on. First O is for onset. If the headache starts in a patient who's greater than 50 years old, it could indicate temporal arteritis, especially if it's associated with fever as well as vision problems. The second O is also onset. If the patient is having a sudden onset of severe headache, in other words, the worst headache of my life or a thunderclap headache, this could indicate the rupture of a brain aneurysm, which warrants immediate medical management. P stands for papilledema, positional headache, as well as pulsatile tinnitus. These are findings that suggest a change in the patient's intracranial pressure, which is an indication for MRI. Papilledema is swelling of the optic nerve, most commonly caused by a high intracranial pressure. The way we examine papilledema is by using a special lens called the Folk lens with the help of the slit lamp examination, as you can see here. Or, if we are not in the office, we can simply use the ophthalmoscope, which is a manual device that can allow us to visualize the retina. And for more appropriate visualization of the retina, we need to apply a special eye drop that contains tropicamide, which is an agent that dilates the pupil that allows us to cast light on the retina of the patient.